Namaste. My name is Dr. Arjun, surgical oncologist at Century Renova Hospitals, Banjara Hills. Today we shall be discussing about colorectal carcinoma. Colorectal carcinoma is the large intestine and the rectum is the last part of the large intestine. The incidence or the occurrence of colorectal carcinoma is increasing all over the world and especially so in India. The causes for this are many. It could be either because of obesity, the food we eat, the air we breathe, habits such as cigarette smoking, and it could even be genetic habits. So if you or your loved ones, if anyone close to you is a known patient of colorectal carcinoma, I would request you to come forward and get yourself checked or screened for the disease, because when diagnosed at an early stage, colorectal carcinoma is an eminently treatable disease. Now you should be asking yourself, okay, it's good to know about colorectal carcinoma, but what are the symptoms of the disease? You could be having bleeding from below. You could be passing blood in stools. You might be having difficulty in passing stools. Sometimes you might be having the urge to go to the toilet. You might even go sit in the toilet, but still you might be having some difficulty. Formed toilet might not be coming. Sometimes instead of passing formed stools, you might be passing liquid stools. Sometimes you might not be passing stools for 3 or 4 days at a stretch. There could even be features suggestive of any tightness in the abdomen, a swelling in the abdomen that could also be seen. And other than this, there could also be other features where you feel that you've lost your weight or you've lost your appetite. Suddenly your pant seems to be fitting a little too loose. Probably you were wearing your belt at the 4th buckle and nowadays you feel that it's like shrunk a little. You might need to use it at the first hole or the first buckle. These are all the features which could be suggestive. Maybe it might not be, but it could be suggestive of any cancer or any malignancy, even a colorectal malignancy. So once you feel that you might have any of these features, or if any of your loved ones is suggesting from this disease, if you could come forward, the usual diagnostic pattern, the usual test we would be doing would be a colonoscopy, where it involves insertion of a camera from the lower part and checking your entire gastrointestinal tract or the entire colon, seeing if there is anything which is suspicious. If there is anything suspicious, it could also involve taking a biopsy or a small sample from that, on the basis of which we will be able to decide on the further treatment. This might seem very scary, but you have to realize that colorectal carcinoma is extremely treatable. And if a treatment is possible, you should definitely come forward and take it. And the usual modalities or the usual treatment which we offer to any patient who's afflicted with colorectal carcinoma is a combination of either surgery and chemotherapy and or radiotherapy. The usual modality which is always offered to the patient is surgery, which usually comes after chemoradiotherapy, or sometimes is even done in an upfront basis. So I would request all of you to come forward. We have the best team over here at Century Renova Hospitals. Please do come forward, get yourself checked out, do get yourself treated, and here's wishing you all a long and healthy, happy life ahead.